So we'll look at two how do I say, two factors that are very very important in drug business. Alright, so you want to actually get drugs for a particular population. You run a healthcare facility or you run a pharmacy. Two things you should always consider is those drugs I'm getting. If I bring them and the population don't buy the drugs immediately, how can I be able to store? Okay, and if I bring the drugs and the population happen to buy these drugs so much and I'm always running out of stock, how can I be able to what maintain the inflow of these drugs? Okay, which supplier can I always rely on to always come through for me in supplying these drugs? So for two of them, you should know that they are critical components of essential drug system. They ensure that medicines are safe, they are effective and available, and of course you are trying to always keep what is needed so that you are avoiding wastages. So principles of drug storage is what we look at first. When we finish, we look at stock control. So principle of drug storage, just like I was telling you guys, different drugs requires different environment. So you have to actually also look at your environment and look at the drugs that fit the weather. Do you understand? So some drugs, they require for you to store them in cool, dry and well ventilated areas. Some of them require that you should protect them from sunlight, moisture and extreme temperatures, either too hot or too cold. Do you see the difference? So you can also use refrigerator for heat sensitive drugs. So organization, where you keep drugs, you have a big store, many drugs. Okay, so it might be hard sorting out. The patient come and they need a random drug that the name starts with letter M. So do you want to start checking one by one? So when you bring your stock, you have to arrange everything very well. So you can choose to arrange those medicines based on the diseases they cure. You can also choose to arrange those medicines based on alphabetical order. So separate expired and damaged drugs, because you don't want to lose the trust of the public. Somebody buys something from you, like let's see, for me now, it wasn't drug, but I bought a toothpaste from a woman. She used to sell in Jos. So this toothpaste was expired. Do you understand? So as the toothpaste was expired, I came to school, I brushed with this toothpaste and it gave me tonsillitis, like heavy tonsillitis, bro. I wasn't able to swallow. I went to that woman's shop, I corrected her. That's when I traveled back home. And of course, I'll never go to buy things in her place, you understand? So I ensuring that everything is very nice, because you don't want somebody come and buy expired stuff from you and they are angry at the end. So security, you have to ensure that the place is free from theft and unauthorized access, because people can access this and take out some drugs that people abuse and go and sell. So safety, store hazardous drugs separately, keep inflammable items from any source of energy. So stock control measures is just you are trying to maintain the accurate records of receipts, issues and balances. So you use stock cards. That's you are just basically trying to keep data. Okay, how much of the drug came in? All right. At what price am I selling? How much profit am I making? What's a rough estimate of the time that it would take for me to sell out this, sell out this stock? So you look at things like the First-Expiry, first out, first in, first out methods. Okay, so regular inventory checks. You conduct routine fiscal counts to reconcile with records, identify discrepancies early to prevent losses, reorder levels. So I'm trying to look at like to what extent would I sell these drugs, then I'll now order new ones. Do you understand? So monitoring consumption, you are tracking the usage patterns to forecast future needs. So if you want to even look at, okay, this particular drug is going like this, so in 2 months time, how will the how will the demand be like? So why this matters is it actually ensures continuous availability of essential medicines. It prevents stock outs, okay, that disrupt patient care. Okay, then reduce wastages to reduce wastage of drugs due to expiry or damage. Then maintaining drug quality and safety for patients.